Hi, my name is Dr. Truck Pham. I'm a chiropractor, and I've been practicing in San Jose for about 22 years. And throughout my practice, I come across with many patients who have these type of injury to the neck, shoulder, and upper back. And I treat a lot of patients who work in the hair and nail industry, and they have this common problem. So today I'm going to share with you, if you happen to have family members or you yourself work in that specific field, uh, that you can do these type of exercise at home on a regular basis to reduce your stress, the stress level that you put on your body throughout the years of working in these type of industry. And if you follow these and you do it regularly, you can reduce your problem at least 50 to 60%, if not more. Um, that way you reduce your time to go to the doctor. Now, if you do this at home and eventually, if your body cannot take care of it, take care of this problem, and you can go to the doctor to get a few treatment, and then that will uh, reduce your stress, your physical stress level down, and you can continue to function with your work, and that you can perform your works better, faster, and more efficiently, okay, and for a longer period of time. So these are the common problem that we see when patients come in who works in the hair and nail industry. For the hair industry, especially for smaller people like Asian people, they have to the chair is higher, so they constantly lift their arm like this, and they work in the hair. So they either use the scissor or they use the cutter to cut the hair, right? So they're doing this motion constantly. So when you do that motion constantly throughout the day, and depend on how busy you are, you could see anywhere between 10, 20, 30, 40 people a day. Then you use these muscle quite a bit. You're using the upper neck muscle, the trap muscle, and the muscle that raise your arm quite a bit. And over time, this muscle will tighten up. Now, this is the outer layer of the muscle that goes from your neck to your shoulder and your upper back. Now, the deep layer, let me share with you the deep layer of the muscle in here. Okay, the deeper layer can goes into the small tiny little muscle. It can goes through your upper neck, and it can goes down to your rib cage. Okay, right, the upper to your shoulder blade or your rib cage. And if the deep layer is tight, it can squeeze the artery underneath it or the nerves underneath, and it causes numbness and tingling down your hand and arms, or it can cause you to have deep pain or sharp pain to your rib cage. So when you move your head in different direction, you will feel a pull and a sharp pain, like somebody is poking you with an ice pick. Now, if you leave that for a very long time, it can travel to the chest because it locks the rib cage up, and it can go to the front part of the chest. Okay, and you start having tension and stiffness in the front part of the chest, or you can start having pain in there. Okay, and this can be, if you get to this point, you have to go to see, you should see a chiropractor so they can assess your spine, your vertebra from the neck, upper thoracic, and your rib cage, and they can perform some adjustment, and that will unlock the area. It will free up the bone and will relax the tissue. They can also do some deep tissue works, pressure point work. They can do some ultrasonic work. Some chiropractor can do some electrical stim, or they can also they can use kinetic tape, and they can tape your muscle and helps it relax much better. Now, that's when you need to go to see a chiropractor, a doctor of chiropractic. Okay. Now, here's are something that you can do at home to see if that can help. If it doesn't help, then you can go see the doctor, or you can do these on a regular basis to minimize the stress level that you have in this part of the spine and the muscle. Okay, so first of all, we'll do some for the people who work in the hair industry. So in the hair industry, you have tightness and stiffness along the upper neck down to the shoulder and to the mid back. Okay, so you can do what you can do is you can use a heat pack, something similar like these. You can very easy. You can purchase one on Amazon. You can go to a chiropractic office to buy one. You can go to a shopping center somewhere. You can buy one of these, and this one we like to use this in our office because it's very easily used. You put in a microwave, you heat it up for 2-3 minutes. Some Asian people, they can heat up salt, like big grain of salt, and put it in a pouch. You can use rice, something like that. But for me, that's just, or you can boil some water and pour it into this big bag, and then you can, put it on yourself. This is very inconvenient, right? So those methods I mentioned above is very inconvenient. You can get one of these. It's very easy. It's only about 30-40 bucks. You can reuse it. You can, if you keep it well, you can use it for years. Okay, you can throw it in microwave, heat it up for 2.5 minutes, and then it's designed where it wraps around your shoulder, so you can walk around, you can sit watching TV, you can read a book with it, you can walk around the house and do your normal things. Okay, and you put this on, and the heat will usually last about 20-25 minutes. What the heat does, it goes into your muscle, it helps increase the blood flow, it helps soften the muscle, and then you can follow up with stretches or massage, specific massage technique that I will show you in a moment. Okay, so you put this on and you can do the stretches. Okay, so you can do side bending stretch, tilt, and turning left and right. And each one of these stretch you want to do for about, you want to hold the position for about 15-20 seconds. Okay, the side that you have more tension, you can hold it up to 30 seconds. You do left and right 3 to 5 times and go through all these stretches several times, at least once or twice a day. Okay, after you do the stretches, you can add this other thing that I'm going to show you how to do. It's very simple, and I found out this helped a lot. And I did this for myself when I was having some neck pain and some shoulder pain that I couldn't get to a friend of mine who's a chiropractor to get treatment right away. And it was a holiday, so I was at home. So I did some of this technique that I found that helps a lot. Okay, so I combine these techniques with variety of other things to help you. So you start out with the middle of your forehead. You can go like this, and you just massage it. Okay, you can do in and out, depend on which area and which way it's more tender. You want to do the area and the way that is more tender than the other. So you rub it in and out. You can rub it this way, or you can rub it inside. Okay, so you can go this way, or you can go from outside in. You want to do about 15 times. Then you will go to the temple area, the side where your sideburn is in front of your ear, and you can go up and down, okay, or you can go front and back. Whichever way is more tender, that's the area your body wanted to be done. Okay, you do about 15 times. Then you will go at the back of your hands, right between the middle of your finger, right? So you just go like this, right in there, right in that groove, and you want to go up and down. Okay, about 15 times. Then you pull your arm. You want to do all these skin to skin. Okay, so you can go here and go up and down your forearm. Just move it around. Whichever is more tender, you rub it a little bit more. You can do some pressure, depending on how much pressure you can handle. You can do it just up and down like that. Okay, and then you can go behind the elbow and up the armpit, up and down the armpit. Now you want to do this both sides. Okay, you want to do left and right. Okay, now after you do that, you can turn your head to the side, and as you can see, you can massage it. Okay, from the back behind your ear, you can massage it down to your collarbone. You just go up and down. Okay, it's easier to go down. It's harder, more difficult to go up, but You just rub it like that. About 15 times. You go the other side 15 times. Okay? Now, the other one you can do is you're behind your skull bone and you just go down your neck. Okay? You just rub it like that. And then you can use the other hand. It's easier because it's harder to use this hand. The other hand, you just turn and you just rub your shoulder. Okay? So if you do both sides 15 times like that, how long does that take? That probably take you about maybe 3-4 minutes, maximum 5 minutes. If you do that combined with the heat pack, that alone will help reduce your pain about 50 to 60% of the time. If you do that, it will help reduce the stiffness too. So, and then afterward, you can move your head left and right, turn your head left and right, and then rotate. Okay, 10-15 times. I do not like to recommend my patient to do head bending exercise because you do that most of the time while you're working anyway, so you don't have to do that again. What I want you to do is I want you to do look up, turn left, turn right, tilt left, tilt right, and then rotation. Now, if you have when you do that, you can hear crunchiness, or if you feel lightheaded, then you should sit down and do this, okay? And when you do that, it will help reduce and release the muscle tension at the same time, unlock some of the joint in there. And if there's anything left that you cannot get rid of for 2 or 3 weeks, then you can go see a doctor and then they can perform some manipulation, some adjustment to unlock the spine, and that will help you heal faster. But these are the things that you can do at home on a regular basis to reduce the muscle spasm, the tightness, and the stiffness in there. Now, I don't recommend patients to massage these part and up unless you have some pain in here. Most of the tightness and stiffness, you want to do it in the back of the hand and the back of the arm. Okay, now these have the same the reason you do that is the neck, the back of the neck and the head and the upper back has similar nerves area in the brain, so that's why when you massage this, it will help calms the brain down faster. It will reduce the pain. I do this on myself. It works really well. That's why I'm showing it to you. So those are the things that you can do if you works in the hair industry. Now you can also do this if you work in the nail industry as well. Okay, but in the nail industry, they do repetitive and long neck bending, so they have other problem. And the other problem is if you don't take care of this, then over time it can cause you to lose the curvature in your neck, okay? Or you people who works in the nail industry or anybody who work looking down a lot, like dentists or dental assistant, teachers, people who work in microscope a lot, right? Over time, if you look at the picture that I show you here, the left side is a normal curvature, which you see is like a bowl. It gives you good flexibility. It opens the joint. It gives the disc a lot of hydration. Okay, as you work and as time goes by, you start losing curvature. Your neck is starting to get too straight. The pressure is starting to increase in the front part of the spine. The disc is starting to wear out. You start having degeneration, and once you start having degeneration, your body want to calcify that area and deposit bones into this area, and the joint become more stiff and is stuck together. Now, when you have degeneration and calcification, this does not mean that you have excess calcium inside your body. It doesn't mean that you drink too much calcium that causes this. It means that the joint have a lot of inflammation, and your body has a natural way to get rid of inflammation is calcification. Okay, calcification means it just deposit calcium in there to kill the inflammation tissue. Okay, so if you have that, if you leave your problem to the right hand side, most likely your neck will be very stiff. You have difficulty turning, looking up, and you start having a lot of numbness and tingling and weakness of your shoulder. Now that doesn't mean you cannot get help. It just means that once you go get extra help with a chiropractic, it just takes longer to heal, and chances are it will not heal at 100% anymore. you will lose some function, some mobility in the area. Okay. um, I will show you a picture of an MRI that we have here, that with people who have um, stiff neck and straight neck, it will put you start having, some people will have, the disc will start swelling and it goes backward. In general, it will put pressure, it will pinch the spinal cord, and again, that will cause numbness down your hand, and you have to take it by, if you start having these, you have to go to a doctor to get some help. You cannot do this at home. The thing that I show you earlier, it will help with the muscle stiffness and tightness, but it does not help very much with swelling disc and pinch nerve. Okay. Now, if you have a swelling disc or pinched nerve and you cannot get to a doctor quickly enough, you can do the exercise, the massage I give you, the forehead, disc, and the neck and the hands. That will help reduce the pain, but at the same time, you can use uh, a cervical collar. You can get this online, or you can get one in Target or Walgreens or some sporting goods store. You can get this, and it depends on how long, how tall your neck are. You can get the 2 inches, 2.5, 3 inches. Now you have to test it out to see how tall your neck is and how comfortable it is when you put it on. Okay, and now once you have this on, we want you to wear this anywhere between 5 to 7 hours during the day, so that your body can have a chance to decrease the swelling in there and can heal itself. Okay, and in the meantime, you wear this at home, but you can go see a doctor and get some help, extra help on it. Now with the nails, with people who works in nail, they also have other problem with their arms and hand. If you want to know more about that, let me know. I will do a video on that and we'll explain how to get to help with that. Thank you for listening, and I hope that this will help you uh, control and manage your problem and manage your injury, and that you can restore more normal function on your daily function, and then at the same time will help you continue your work and earn a living to support your family and what you love. Okay, you like this? Please subscribe, put a comment down there, and share with the people that you work with, and hopefully this will help them. Thank you.